Have you had hip replacement or PHR recently and still struggling? Add these 3 exercises to a regime. They could help you immensely.
In the first exercise, we're working on your glutes. You're going to lie down on your tummy with a pillow underneath your tummy. You're going to bend the knee and lift the leg so that your foot faces towards the ceiling, and hold it for 10 and then go down. For the second exercise, we're working the gluteus medius. What we're going to do, we're going to lie down on your side with the bottom knee bent. You're going to lift the top leg to 20 degrees and slightly rotate. Hold this position for 10 seconds and then go down. For the third exercise, we're working on the mobility of the hip. You're going to do heel slides. Try to target till the 90-degree range. Slide and then slide back. And do it again. And slide back. You can also add ankle dorsiflexion in this. So you're working on 3 components at the same time. Ankle, knee and hip. For further queries and personal treatment for hip